Sprains and strains are injuries to the soft tissues surrounding bones and joints caused by overstretching or sudden violent movement. A strain involves muscles and tendons. Tendons are strong but inelastic fibrous cords joining muscle to bone or muscle to muscle. A sprain involves ligaments, which are tough, fibrous, partially elastic tissue. They bind bone ends together in joints and also support internal organs. Sprains and strains result in restriction of movement, swelling, bruising and pain. It can be difficult sometimes to tell if an ankle is sprained or broken. For simple sprains and strains, the management can be remembered by using the word RICE. R is for rest, I is for ice, C is for compression, and E is for elevation. All help to reduce swelling and pain. The casualty does not have to be confined to bed, but the limb should be rested. An ice pack may be applied, but it should always be fabric covered and never left in place for longer than 10 minutes in every hour. A bag of frozen peas will work just as well. A compression bandage should not be applied until the foot can be placed comfortably at a 90-degree angle to the leg. When in position, it should be placed to reach from the base of the toes to the knee, that is, from joint below to joint above the injury. An elastic crepe support bandage is best. Make sure the bandage is not too tight by checking the circulation and sensation to the toes. With a sprained wrist, watches and jewellery should be removed from the injured limb before swelling becomes too severe. Then a compression bandage should be applied from the knuckles at the base of the fingers up to the elbow to give full support. Check the bandage is not too tight by monitoring the circulation and sensation in the fingers. Then support it in a high or elevated sling to reduce the swelling. In this section, we have shown how to deal with soft tissue injuries which are relatively common, and treatment should be carried out using RICE, rest, ice, compression and elevation to reduce swelling and to aid in recovery. If there is any part of this section you do not understand, please revisit the relevant information, and when you are confident you understand, move to the next section. More information can be found in the accompanying workbook.